Alrighty. Well, good afternoon, everyone. I would like to welcome you to the Lunch and Learn about breast cancer resources hosted by the Program for Elimination of Cancer Disparities. My name is Crystal J, and I'm one of the PCAD's Public Health Research Coordinators. We felt this Lunch and Learn was imperative to close out Breast Cancer Awareness Month by providing the community with various breast resources and tools to increase knowledge and increase awareness. For our viewers, we're not able to see or hear you, but we do encourage you to ask questions in the Q&A box below. Before we begin, I would suggest for everyone to just relax, pull out a piece of paper, eat your lunch, and take a few notes. The panelists will have 8 to 10 minutes to just discuss their organizations and programs. Without further ado, this afternoon I am joined by 5 wonderful ladies: Heather Burns, the Director of the Program and Outreach for Gateway to Hope; Kellie Fields, the Breast Health Program Coordinator for Betty Jean Kerr People's Health; Cheryl Jackson, the President of the Breakfast Club, Inc.; Valita Keys, the founder of Valita's Hope; and Corey Smallwood, the Regional Director of the Pink Ribbon Girls. To begin, we'll start with Heather Burns. Heather, can you tell us more about Gateway to Hope and its resources and the organization has to offer?
Yeah, thanks, Crystal, and thank you all for participating in this meeting today. So really excited to be a part of this. This is quite the group of panelists today. So I think there's going to be a lot of good information that'll be shared with everybody that's a part of this. So as Crystal said, my name is Heather. I'm the Director of Program and Outreach with Gateway to Hope. So Gateway to Hope was founded about 15 years ago, actually, and our organization supports individuals who are going through treatment for breast cancer at this time. So we have a few different programs available for patients as they're undergoing their diagnosis and their treatment. We have our direct financial assistance program where patients are essentially paired with an patient advocate or a patient navigator who will work with them through the process of their treatment journey, providing them with resources and psychosocial supports as they're undergoing this really challenging period of their lives. So we have found that the more support that these individuals, primarily women, are, the more supports they're wrapped in, the more positive their treatment outcomes are. And that's a really important aspect for this diagnosis, is because we want to increase those positive treatment outcomes, as that is crucial to survival. So some of the like I said, we have social workers who provide this service to individuals, and on top of the patient services, we have the direct financial assistance, the navigation and treatment support, and we really work to empower the women that we serve with the tools that they need to feel comfortable talking with their treatment team if they feel like their treatment needs are being met, and just working with them to critically think through some of these challenges that they're faced with. So in addition to the direct financial assistance aspect of our programming, we are really ramping up our community engagement and community education work. As I'm sure everybody can relate to, 2020 has really challenged us, and we engage if you would like to, just from a safety standpoint for the communities that we serve, as well as our organization. So what we have been able to do at this time is really reflect on the community needs that have been expressed through various forums, whether it is through the Prepare STL organization, the information that they have gathered, or if it's from information we've received from our patients specifically. We're really reflecting on that information and using that to guide us for future planning and programming. So getting more involved with assisting women with navigating to their screenings. Working with community partners that are present here today, getting more involved with the Show Me Healthy Women program and helping guide women to those services as well. So that is another level of our programming that we anticipate elevating in the years to come, and just being a part of the community work that's taking place to address the disparities that exist in the St. Louis region as it relates to breast cancer and mortality rates between Black and white women. So doing a lot of work in that regard, again, collaborating with our community partners, many of who are part of this call today, and just making sure that we're bringing the community to the table and hearing what the needs are versus assuming what the needs are. So I think that's a huge piece and a huge consideration that needs to be kept in mind for the work that we're doing. So again, as I mentioned, the organization was founded about 15 years ago. The original need was, and the original agency format was a donated care model. So our founders, Dr. David Kaplan and Dr. Marla Shu, both surgeons, recognized a need for services for women who were uninsured and had a breast cancer diagnosis. So they connected with their counterparts and their colleagues throughout the region and basically rallied together to get all of the services in place for somebody who had a cancer diagnosis. So everything from chemotherapy to radiation to surgery and diagnostics. And once the organization was formed and had been operating under that format, they recognized a need to change to another model that would better suit the patient's direct needs. And some of that was, again, the direct financial assistance that we're doing today. So, and then we continue to evolve and grow. And like I said, really focusing on that navigation support services that Gateway to Hope provides. So that's a little bit about Gateway to Hope and our work with patients and the community.
Thank you, Heather, for telling us a little more about Gateway to Hope. Next, we'll have Kellie Fields from Betty Jean Kerr.
Hello, everyone. How is everyone doing today? So my name is Kellie Fields. I'm the breast health care coordinator for Betty Jean Kerr People's Health Centers for the Show Me Healthy Women program. So a little bit about Betty Jean Kerr People's Health Centers has been around since 1972. We partner with Show Me Healthy Women program about roughly 12 plus years now. The Show Me Healthy Women program offers free breast and cervical cancer screening programs for Missouri women ages 35 to 64 years of age. Are open back up to the public. Our patients has the option to either do an in-house office visit, or they can do a telemedicine visit as well. Betty Jean Kerr People's Health Centers offers a list of ranges of many services. We have women's health department, we have internal medicine, radiology, WIC, pharmacy, and pediatrics, and many more. So currently, in the last 3 years, we decided to create a team called the Clinical Measures Team. Basically, the Clinical Measure Teams is our outreach program. We try to go out to the community on Monday, Wednesdays, and Fridays to let the community know that we're here, what resources are available to them, and how they can go about making appointments. What else? The screening for the COVID testing, we're making sure that when the patients come in, entering into the facility, that we're making sure we're taking their temperature, asking them screening of questions, and we're also placing like a blue sticker on their shirt or jacket to let the staff know and alert that they have been screened. Also, if you would like more information, we do have a website which is called phccenters.org. And if the new patients would like to make an appointment, they can be called at 314-226-1718 for an appointment. And that's currently it. Thank you.
Thank you, Kellie. Next, we'll have Cheryl Jackson.
Hello, everybody. It's an honor to be here with all our community partners and all. The Breakfast Club started 23 years ago, very informal, because a young lady had been diagnosed with breast cancer. In an effort to help her with her journey, that's how the Breakfast Club got started. We met at a restaurant, we met for breakfast. That was a 4-hour breakfast. And she asked if that could continue. And so fast forward now, we have various programs that we feel are needed in our community. We have a bra and breast form program that when women are medically underserved, uninsured, we can send them to Medical West and they will be professionally fit. And we provide that. We're always looking for funders to take on programs because right now we're funding that. We have a program that we call Faith on the Move, and that is where we were working with we were working with Missouri Baptist and we were working with Mercy, but those vans have been basically pulled in. And so now we're only working with Siteman for the women to get their mammograms, and also the churches. And all churches are not open, but for the churches that are open, we are doing, even in this COVID pandemic, we're doing pretty well as far as encouraging the women to get their mammograms. So that's going even in COVID. We have a breast health buddy program that when women are newly diagnosed, they will call into the breakfast line, which is in our house. And I will talk to them. Generally, I'm the first to talk to them. And then I will send that information to our project director who matches them up with a buddy. Now, before COVID, we were able to actually meet one-on-one, face-to-face. And so now that's being done by, the support is coming from calling, cards, staying in touch with them, giving them comfort kits, getting that to them. So that is still going on even through this pandemic. The comfort kits is just when women are newly diagnosed, and they don't have to be in the Breakfast Club to get those comfort kits. But if we know someone is newly diagnosed, we're able to get those comfort kits to them. And they have just personal items and articles and books and things like that that can help them during those rough times. We also have a healthy eating program that has been quite successful. But then with COVID, we had to turn it to Zoom. But we found a way to be able to make that happen. Send them information. We partner with the University of Missouri, and so we're working together on that program. But we also, so Zoom is why we had to end up going that route. So they get information on breast cancer and data, and then they also learn how to eat healthy and avoid those foods that they shouldn't be eating. For the ones who graduate from the classes, we took them shopping, so to ensure that that they would get healthy foods and that kind of thing. But we found a way to still be able to give them certificates, and they get little things that also from the program, and they still get their gift card to buy. We hope we feel like they're being honest, and we're trying to encourage them to get the healthy foods. We had to cancel. We normally have an annual seminar every year in June, but because of COVID, we had to cancel it. So we've had to cancel a lot of our events, but some of the programs that we have been able to continue is, like I said, the bra and breast farm, the buddy, the Faith on the Move, and the healthy eating. our partners, we work closely with them. As we said before, some of them are already here on the line with us. And we started with our monthly support group meeting on conference call. And then recently we went on and switched that to Zoom. And we have had some speakers who also have been speakers for our support group. We have the Breakfast Club Brothers. They have been instrumental in our program. They've done things like designed our website, monitored, been over some of our events, and we have a 9-member board that looks at our programs and evaluates what we're doing, and tries to make things still what the community needs, and we try to do those things that the community needs. So I think I've just about covered everything. So we've been able to still make it even through this pandemic and still provide the services.
Thank you, Cheryl. Next, we'll have Belita Keys.
Good afternoon, everyone. Can you all hear me?
Yes.
Yes.
Okay.
No.
Belita's Hope was founded by me. I was diagnosed with breast cancer twice before the age of 40. I've had 7 surgeries in the last 10 years. And with those surgeries, it was very hard for me to rest and basically heal, because I couldn't get in my bed and I couldn't get comfortable on the couch. But I found that my husband's recliner was a blessing. After coming home from the surgeries, I came home with 4 surgeries. One surgery came home with 6 surgeries. With 6 drains. 4 drains with 1 surgery, and then maybe 6 drains with the other surgery. And I just couldn't get comfortable in my bed or even on the couch, and my husband's recliner was just a gift. And so I had decided that I wanted to give women that undergo a double mastectomy recliners. And so we've been doing that since 2012. We've been a non-for-profit since 2012. And right now we're giving women recliners at curbside due to the COVID-19. We just gave a recliner away this morning before 9. She's going to be having surgery tomorrow, and this is because of the COVID-19. We're delivering recliners at curbside. And so we also do have a post-surgery comfort kit we give to the ladies, and that consists of customized blanket and pillow, back scratcher, mints, crossword puzzles, facial wipes. That consists of their post-surgery component of everything. And that's our comfort items for her program. And of course, we always have our It's Mammogram Monday. And right now that's on Fox 2 News. Every Monday, we're reminding women to make their appointments and keep their appointments, and of course to continue to donate so that we can continue to provide recliners to the women in the community. And again, this year alone, we had to cancel our annual, our 9th annual Pink and Pearls Luncheon. This is where we honor the survivors, we honor the physicians, we're honoring the caregivers. And this year we had to cancel because of COVID-19. And we did have a donation day, and some people donated, and we appreciate the donations, and we always welcome donations. And here lately, we've been given a lot of social and emotional support. So many of us have had COVID-19, our family members. A lot of the women are going into surgery just so, I would say not depressed, but just the not knowing, because they have to have the COVID-19 testing before their surgery. Then when they come out, it's just been a lot. So we have been doing a lot of emotional and social support for the ladies. Also, We work with the Breakfast Club with our mobile mammogram. The Breakfast Club has been a true blessing to us when it comes to mobile mammograms. Of course, this year has been kind of crazy, but fortunately, not unfortunately, but fortunately, the St. Louis Public Library at St. Charles Rock Road has agreed to let us continue to have our mobile mammogram this December. It's Saturday, December 19th at 9 o'clock. So we are actually promoting women to go ahead and make their appointments. This is the end of the year, and that's why we have a mobile mammogram day at the end of the year, because this year alone, can you imagine how many women have made their appointments and had to cancel their appointments and they have not rescheduled? So that's part of the reason why we have a December date, because we want the women that have not made their appointments, have not scheduled their appointments, have forgotten about their appointments. This is your last chance in December to make and keep your appointment. Our website is www.believershope.org. That tells you about what we're doing, how we're doing it. And also, if you know a woman that has been diagnosed, needs some reading materials. I am an author. My book is My Strength is Your Strength. This is my book. This is my story. It has everything in it, from the items you're supposed to have once you have your surgery. It tells you it even have Gateway to Hope in here. I mean, it's my story. And this book, I've gotten good raves about it, but if you know anybody that just wants to read a woman's story, this is my story. My strength is your strength. Also, I have provided a journal for anybody that's going through. We have so many questions and concerns. Once we have surgery, we forget. So this journal is a tool for you to write down your questions and concerns for when you go to your follow-up appointment. So that's pretty much it. I want to thank all of you all for keeping up the great work that we're doing in the community during COVID-19. That's about it for me. I probably have missed something, but it's COVID-19. We do have a girls' fit night where we partner with Nordstrom, and the teenagers come out to learn how to wear a bra, to put on a bra, the best bra that you should wear. But we haven't did that because it's COVID-19. And I believe I have covered everything. Again, I've covered our recliners for her. We're still delivering recliners. So if you know a woman that has been diagnosed, you can refer them to Believe's Hope. We are delivering recliners in the COVID-19. We're wearing our masks, we're taking temperatures, and we're delivering them at curbside. And that's the same thing with our comfort items. We have the blanket, the pillow, and we also provide the women with button-down gowns, because when you have a double mastectomy, you can't raise your hands over your head, and you don't figure that out until you try to raise your hands over your head. So we provide all of the women with button-down gowns, and it's really like a relief, because the only thing you have to do is basically unbutton your gown, and those drains are like your baby. So we do have gowns and slippers as well with that comfort items. And again, our girls' fit night, we have not done that. The mobile mammogram, again, is December 19th this year at the Rock Road Library, and they are taking women appointments now. We're not full, so you can call 747-7222 extension 2 and make your appointment for that day. That's on a Saturday. So if you work Monday through Friday, this will be a great day, a great place for you to come, because it's centrally located. And again, our Pink and Pearls luncheon was also canceled, and we look forward to having it next year if that's the will. And again, we will continue to remind everybody about It's Mammogram Monday. Make and keep your appointment. Thank you so much for believing in Believe's Hope. We will continue to win lives where we can. You all, I'm going to drink some tea, and that's about it for me.
Thank you, Felita, for sharing that amazing information. Next, we'll have Corey Smallwood from the Pink Ribbon Girls.
Hi, everyone. I'm Corey Smallwood. I'm the Regional Director for Pink Ribbon Girls St. Louis. I just love listening to Valita talk and everyone else. It's just so awesome to be the last person to present because I get to hear all these wonderful things, and we're so lucky in St. Louis to have such great resources. So my hat is off to every person on this panel. Pink Ribbon Girls. So Pink Ribbon Girls St. Louis, we just celebrated our 2nd anniversary here in St. Louis, and our mission is very simple. We provide meals, rides to treatment, house cleaning, and peer support to anyone, regardless of income, battling breast or gynecological cancer. Our services are absolutely free, and we only require, there's no financial limitations. We don't require any kind of financial documentation. We serve anyone regardless of income. Pink Ribbon Girls as an organization started about 10 years ago in its current iteration in Dayton, Ohio. And a small group of St. Louis physicians and community members heard about the mission in Ohio and worked really hard to bring it here to St. Louis, like I said, 2 years ago. And so we offer 2 different programs. We offer our Simply Fight program, which is for breast cancer stages 0 through 3. And it's 3 healthy meals a week times as many people are in your family. So if you have a family of 5, you get a box of 15 meals. Our meals are frozen, individually trayed and frozen. 100% of the food that we use in our meals is donated by Schnucks Markets, and we partner with Nourish, and they create our meals for us out of their kitchen at Westminster Christian Academy. The meals are frozen and they are delivered once a week directly to the doors of our clients and their families. We serve a 40-mile radius in St. Louis, which includes Missouri and Illinois. I always say we tend to cover all of the villes in Illinois, so Caseyville, Collinsville, Edwardsville, all of those guys as far south into Jefferson County, Festus, and then kind of not quite to Washington, but definitely Wentzville and up to Alton. So we do healthy meals, and then we do a light house cleaning every other week. We work with professional vendors, bonded and insured companies that do house cleaning. And that's a light house cleaning every other week if we have a vendor that serves that specific zip code. Transportation, we provide rides to treatment during the duration of your services, which is 2 months for the Simply Fight clients. And so the rides to treatment program, we partner with Uber Health. And that's been a great thing because I always say they can send 5 cars to 5 places at 9 a.m., all at the same time. So it doesn't limit us as to the number of people that we can serve getting them to and from treatment. We also have our No Age, No Stage program, which is for individuals with stage 4 cancer. And the services just are extended, so they receive about 3 months of services. In 2019, we implemented the 2-question food insecurity survey from the FDA and found that 41% of our clients do suffer from food insecurity. So we've done some special collaborations with Operation Food Search. And then during COVID, we were able to increase meals from 3 meals a week to 5 meals a week with special funding opportunities for those individuals that are fighting both food insecurity and cancer at the same time. Last year in 2019, we served over 16,000 meals, gave over 1,400 rides to treatment, and cleaned 177 times. And to date, we've already hit over 20,000 meals served in St. Louis, given almost 2,000 rides to treatment, and cleaned 169 times. We did put cleaning on hold during COVID for a couple of months, but that is back on track now. We were able to serve an additional 1,700 meals during the months of May and June, which was great for our clients that needed that extra, all of our immunocompromised clients that should not be going to the grocery store or even a food bank to get food. It's been so essential from their perspective to have those meals just magically appear at their door. So we are expecting an influx like everyone else, I'm sure, of clients. We're serving more people than we've ever served due to everything that has happened with the pandemic and people not being screened for cancer, mammograms, or for gynecological cancer. just a couple other statistics, about 77% of who we serve in St. Louis does suffer from breast cancer, 23% gynecological. About a quarter of all the clients that we serve are stage 4 and have metastatic disease. Our youngest client is 20 years old, and our oldest has been 87. We've served 86 different zip codes in St. Louis in that wide 40-mile radius. And if you know someone who needs services that's 42 miles, we certainly will not turn someone down like that. It's just a gauge for us. Obviously there's an expense that we incur, outside of that 40-mile radius, but we are here to serve people who need it. I think that's about it for Pink Ribbon Girls. Oh, we also offer peer support. There's so many amazing, unbelievable organizations in St. Louis that do peer support. And so for Pink Ribbon Girls nationally, our type of peer support that we usually do is truly peer-to-peer, and it's usually at a activity-based, painting or makeup class or something kind of outside of a hospital that is truly peer-to-peer. However, with the pandemic, and we really honestly had not even gotten that up and going in St. Louis, because there are so many other great organizations and resources here that offer those types of things. But with COVID, we do have an individual that runs our peer support nationally, and she's been able to do, we've moved it all online, obviously, but one of the good things that has come out of this pandemic is that we're able to offer peer support in a very specialized way. So we're doing a young mother peer support group with individuals from St. Louis, Ohio, California. We're also able to offer, stage 4, very specific peer support. There's a male peer support group that's going on right now, and they meet monthly. So all those resources are on our website too. So we have a really robust advisory board here in St. Louis, which we're really grateful for. We work with anyone who calls us. If you know of anyone who needs support from Pink Ribbon Girls, all they do is go on our website and click Get Support, and they'll fill out a form, and we'll have one of our client coordinators call. It works best if someone can refer our services people that need them, to say, since we are new in St. Louis, Pink Ribbon Girls, the best way it works is if a hospital, a nurse navigator, someone from another organization can say, you should really check out Pink Ribbon Girls. They can help you quite a bit with transportation and meals and cleaning. So please keep us in mind if you have someone or know someone who needs our services. Like I said, we are just in 2020, our goal was to just really increase our brand recognition. If anyone needed us, we wanted them to know about us. And so obviously with the pandemic, that's been a challenge, not being able to have events and things like that. But we definitely, I think it's like with all of our organizations, it's just a word of mouth and having the knowledge and being able to share our mission with whoever we can. So I think that's it for us. Thank you.
Thank you, Corey, for sharing. So thank you, ladies, for providing your information about your organization and the resources it has to offer. Also, thank you, audience, for listening. We will now answer questions in the chat or the Q&A section. As a reminder, you can you can ask questions in either one. I'm going to check the chat. Belita, we have one question for you. It says the bra fitting program is such a great idea. Are you all considering offering that virtually for girls or really adult women, or only adult women? Belita, you're on mute.
I haven't thought about that, but that is a good idea. I actually been thinking about doing some things virtually. Of course, I'm looking for some help with that, so maybe we can connect.
Okay. And then, let's see.
So who asked that question? I'm sorry.
Someone from our audience.
Oh, okay.
Are there any more questions? Someone for the audience said, I have had a number of patients recently who have felt they have not had a lot of support once they are finished with treatment. Do any of you have a suggestion for an agency to assist with follow-up support?
I can probably address some of that. Everybody in our age group for the Breakfast Club is anywhere between 28 years old and all the way up to 80. And so we're open certainly to any of the ladies that want to join the Breakfast Club. We have, they don't all have to have breast cancer either. But there is there is support needed even after, that's what we found, even after your treatment, because then you're not seeing the doctors as often. Sometimes you'll have different aches and pains, and a lot of times your mind goes to, oh my God, something is wrong. And so you need support even after those, after that time. Now, even though our buddies will buddy you for up to 9 months after your cancer journey, you're still welcome to join the support group or join us, period, because you need a different kind of support. Just to look around at women and think, oh my God, if she's like 28 years, I can get there too. So that support is needed well after the initial. So yes, I put, the Breakfast Club has a website. You can send me a message on there and we can get in touch with you, and you're welcome to join us.
I'd just like to add something to that too. And Amanda, I saw that you asked that. Amanda is a wonderful resource, and she's a social worker at Siteman North. So I'm just putting you on blast because you've been such a great collaborator in the work that Gateway to Hope has been doing with patients. So that is something that is on our radar right now in terms of how to provide that support after treatment, right? The survivorship, that's such a huge piece of this that we recognize. And in some of our end of assistance evaluations, we've had patients mention to us too, like, what's next? Like, what do I do from here? So we are doing kind of an exploration of what exists, like things like the Breakfast Club that we can refer women to, and then really just making sure that there's more of like a warm handoff with our collaborators versus just being like, okay, treatment's done, we're done. Like we are implementing things, like we started to do mailings to keep some of our engagements up, and we're continuing to explore ideas. But I'm always open to having further discussion about that. Like, how do we collaborate better in the survivorship aspect? Because so many of our organizations do focus on the treatment sector, that how do we really look at building a collaboration? And like I said, the Breakfast Club is a great resource in terms of survivorship programs, and then just having that available for the women that we work with.
Okay. Anyone else? The next question is, what would you recommend as a first step for a woman newly diagnosed with breast cancer? And that's for anyone, any of the panelists.
Well, we get referrals from different, from the hospital, social workers, and even word of mouth, someone that's in the Breakfast Club or has been in the Breakfast Club. And if a woman is newly diagnosed, she can call our number, which is the 314-972-8883. And we will make sure that she gets connected to a buddy. Not only a buddy, but if she's got issues, financial issues, we referred a lot of women to Gateway to Hope. We've worked with Corey when people have had surgery and they need help with, cleaning, meals, getting to the doctors. I've worked with Kellie at People's. Valita, like she was saying, I think having a network where you can refer and that you can recommend is really, really helpful. And a lot of women still don't know that these resources are out there. So sort of connecting, that helps them to, the other thing I want to say too is, I have, I'm able, but by way of my church, this was a partnership too. We became like a wellness champion. If you went through so many classes and all that you learned about trauma. And basically what that's all about is you can refer women for, like, if they're having just kind of down, this is a really rough time, you can refer women to them, and they will allow them to get 5 free counseling sessions. And so everybody has resources, and kind of connecting those resources. And really the main thing is, it's called the behavior, let's see, what is it? Behavior Bridges to Care. That's what it's called. So I think that by having those resources, that helps women a whole lot more to try to deal with the breast cancer, deal with all these other issues, and try to still keep them where, you know, they're going to make their appointments, they're going to keep their appointments, just kind of feeling like they're not the only ones that have ever been diagnosed. But a newly diagnosed woman can call us anytime, and we'll at least try to make sure they get started with the support, the referrals they need, that kind of thing.
Okay.
I would just
Anyone else?
add, I can add something in Pink Ribbon Girls too. You know, we're women. We don't ask for help, right? So, you know, we often have, you know, often our client coordinators will talk to newly diagnosed patients that say, I'm fine, you know, I'm good. I don't need meals. I have a car. I can drive myself to radiation. And we really encourage people to just sign up. You know, a meal is a really simple thing. If you sign up for PRG, then the meals are delivered to your house, and you don't know that you need them necessarily, but you might, you know, and you can always, it's just such a simple, easy thing that makes you feel cared for, like Cheryl was saying. You know, that's what we try to provide, that PRG, you know, warm hug that people need when they don't even know that they need it.
I want to say to Corey, thanks again. We did have a client that received recliners, but she had breast cancer for the second time, and we referred her to Corey, and you all did an amazing job. However, she's no longer with us. She died in April. So she has an 11-year-old son, left her husband, and I was thinking about the holidays. It's been so rough here in, I guess, across the world. And I want to let you all know that I do have, I was able to get in contact with St. Louis Area Food Bank. And if you have any, I have a few vouchers, food fair vouchers. And if you all know or have any clients that want to have some of these vouchers or one of these vouchers, please contact Believers Hope. I do have some here, and this is for Thanksgiving. This food fair is held on November 24th from 10 to 1, and all you have to do is bring this voucher and you can get food for the holiday. So again, we do have some food fair vouchers, and basically this has came from the St. Louis Area Food Bank, and we want to help anybody that needs some help throughout these last few months, especially with food.
I also want to say something. At People's Health Centers, we also offer food banks. We have different in the surrounding city areas if you're in need of food. We also have social services here at both locations, Delmar site and North County. If someone just want to come in and talk to one of our social workers. We also have, if the ladies or the families are having troubles with trying to pay their bill, we have resources for that. Where energy assistance is needed, things like that.
Okay.
Thank you.
All right, our next question. Are your resources only for people in the St. Louis area?
So
And
I
this
can
question
speak
was
for
open.
Gateway to Hope. So Gateway to Hope, we cover the entire state of Missouri and Southern Illinois. So primarily our patients are in the St. Louis region, but we will cover those individuals outside of the St. Louis region as well.
So Believers Hope has delivered recliners in Illinois, Kansas City, South Africa, and Michigan. So that will take some time to get a person what they need if they need a recliner. But we serve St. Louis and Illinois as well.
And we serve generally metropolitan St. Louis.
We also is St. Louis, Missouri as well. But the Show Me Healthy Women also is offered in Illinois.
Pink Ribbon Girls, we serve Dayton, Cincinnati, Columbus, the Bay Area, California, and then this 40-mile radius in the St. Louis region, including Illinois. However, our future, hopefully, is that our meal program can be delivered anywhere in the near future, hopefully. So that's our 2021 goal. Stay tuned.
Okay, our next question. With the upcoming flu season combined with COVID-19 and the cold season, how does your team plan to engage the community? And that was open.
Believers Hope has been given some masks from a Ford Motor Company, the Pink Fund. So we're giving out masks to our clients and their families just to prevent COVID-19 or the flu.
Okay.
Yeah, that's the same thing. Like mainly, like we've been doing masks, and this is another resource, but up to starting in June at our church, we did COVID testing once a month, and last month in September we did October, we had flu shots too. So anything like that in the community that's going on, we inform our members as to additional resources. And so that was one of the things that we offered to the whole community, but I made sure that the members of the Breakfast Club knew that. So some did take advantage of the service.
Mm-hmm.
I also want to say something. Betty Jean Kerr is also offering free flu shots on November 21st, starting at 8 o'clock that morning. We're giving away free turkeys. We're also doing free COVID testing as well. And some more other things will be happening with that too. We're kind of getting it ready. Also, we are offering COVID testing on Wednesdays here at the Delmar location from 8 to 12. Also on Fridays, we offer the COVID testing at the North County location on West Florissant from 8 to 12, just to let you all know that.
Yes. Okay. Next question. Do you have opportunities for people to volunteer or otherwise get involved? That was open.
Believers Hope is looking, we're definitely looking for volunteers, and we have been looking for an intern for the longest. So yes, we definitely need volunteers at this time. Preferably right now, it's COVID-19, so this person will have to wear a mask and have to get her temperature or his temperature taken every time they come into our office. But we're definitely looking for an intern or someone just can volunteer with some of our office work. And if you know someone, yes, but we're always looking for volunteers.
Okay.
I'd have to say, yes, the Breakfast Club always encourages volunteers.
Yeah, and from Gateway to Hope standpoint, we are always looking for volunteers who are interested in getting out in the community as well, alongside with us, and participating in some of our community engagement work. And then there, of course, are, in a normal year, not really 2020, opportunities to volunteer at different events and in our offices. So if anybody's interested, they can definitely reach out to me and we can talk about opportunities available.
Same here for Pink Ribbon Girls. I'll be the bookend. We actually do a hybrid of meal delivery. So Pink Ribbon Girls, we're set up for this pandemic in a couple different ways, surprisingly. So our meals are frozen and packaged and delivered via courier and volunteers to people's houses. So we do work with volunteers to make meal deliveries that are socially distanced. They are left on the doorsteps. And we also, need volunteers for events and things like that too. So.
Okay. This one is for you, Corey. Do you think there will be a protocol in place to start the cleaning program, or to bring it back?
So the cleaning program is back. We only work with, bonded and insured cleaning vendors that we have vetted. So kind of the caveat to that is there's not a lot in St. Louis that are bonded and insured and are willing to work, take on clients in addition to, whoever their clientele are. So, we say we offer house cleaning, which we do, if we can find a vendor that will clean in your zip code. So we are always looking for bonded and insured cleaning vendors. If anyone has any recommendations, we have worked with a couple different providers in St. Louis, some that, have called and said, we're just overloaded. We can't take on one more Pink Ribbon Girls client. So, and we do pay vendors to do these cleanings. So it's not like we're asking them to donate the cleanings, but it is a challenge. Since that is a third party, there are protocols in place there, by those vendors. But, it's definitely, the house cleaning for us is the biggest challenge in trying to offer our services. But to Valita's point, it's so important. If you can't raise your arms above your head, you can't clean your own bathroom. So it's something that we're dedicated to. It's just, it's definitely a challenge. So if anyone ever has any ideas about cleaning companies that they can recommend to us, or any concerns that they've heard from clients or anything like that, please let me know.
Okay. Are there any more questions? I don't see any. Let me check one more time. I don't see any. So I just want to thank everyone for joining us this afternoon. If you would like to learn more about PCAT and the other organizations, we have dropped the information in the chat. I just want to thank you for being a part of the PCAT's Lunch and Learn, and we look forward to seeing you at the next one. I hope everyone has a great day.
Thank you, you too.
Thank you.
Bye.
Bye-bye, everybody.
Thank you, Crystal.
You are welcome.
Yes, this was a great time. Thank you, Crystal.
See you later.
Bye-bye.
Bye.